Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up, a genetic test for breast and ovarian cancers is now more affordable. John?
The test was developed by a startup company in California. It says the test offers a cheaper and easier way to determine a woman's risk for these conditions.
Testing for the BRCA1 and 2 breast and ovarian cancer gene mutations used to cost up to $4,000. Elad Gil is the co-founder of Color Genomics, the company now offering testing for those 2 genes plus 17 others for only $249.
What we've tried to do is really democratize access to this type of genetic information around breast and ovarian cancer risk, and we wanted to do it in a responsible way.
A woman with the BRCA1 mutation has a 55 to 65% chance of developing breast cancer by age 70. The test must be ordered by a physician, either the woman's own doctor or one provided by the company. Genetic counseling is included in the price.
We don't provide any sort of specific medical advice. Our focus is on enabling women to get this genetic information back.
Color Genomics says it has achieved the low price through improved lab and software automation and direct marketing to the public.
Spit into the funnel until the amount of saliva reaches the fill to line.
The test done on saliva collected at home is not covered by insurance. Known genetic mutations account for only 10 to 15% of breast and ovarian cancers. Oncologist Dr. Jennifer Litton of MD Anderson Cancer Center says this means proper counseling is key.
I would be concerned if people misinterpret a negative result as being no risk, especially if they come from a family that has a lot of different cancers or young onsets of cancers.
John, why are we hearing more and more about genetic testing?
Because it's getting cheaper and cheaper and more easily available. So over a decade ago, it took about $400 million to sequence the entire human genome. That's now approaching $1,000. So as it becomes cheaper, more widely available, you're going to see more and more genetic testing. Now the question is, how exactly do you interpret it?
The FDA held hearings this week on the safety of homeopathic medicine. For the first time in nearly 30 years, the government is looking at whether to regulate natural remedies the same way it does over-the-counter drugs. So what are some of the homeopathic remedies that are really popping up, and why would they change the rules for these?
Sure. The FDA in this case is really focused on homeopathic remedies that are sold over-the-counter in health food stores and drugstores. Some of them are prescription only, but most of them are over-the-counter. They tend to be very diluted forms of herbs or minerals. Some of the more popular ones you may have heard of are Zicam or Cold Ease. The issue is, unlike other over-the-counter drugs, like for instance aspirin or Tylenol, the safety and effectiveness of these drugs isn't tested before they put it out on the shelves, on the market. So there really isn't any evidence to say the drugs do what they say they do.
Well, John, what are the potential dangers of homeopathic remedies?
Well, I spoke to the FDA about this, and I also read the online materials because of this hearing. And there are 3 main things. The first is, as Holly says, the safety and effectiveness has not been proven beforehand by the FDA. So there are questions, as this has gone from a multi-million to a multi-billion-dollar industry, of exactly what is in these medications. So that's one thing. The other thing is they can be in the pharmacy right next door, right next on the shelf to over-the-counter medicines that have been evaluated more carefully. And the consumer may get confused thinking, well, they're right next door to each other, then they're kind of the same. And the third thing is, and this is probably the most serious, that people can sometimes not do proper treatment because they want to go the homeopathic route. And there was a very poignant letter that was written on the FDA website as part of this testimony about a guy who talks about his wife who was diagnosed. She found a breast lump. It was breast cancer. And instead of getting proper treatment, she went the homeopathic route, had some other alternative therapies, didn't get proper treatment, and died.
As John mentioned, though, so many people, even now I have a little bit of a cold, so many people have suggested natural remedies. What will the FDA do? Are there a series of steps to approval?
Right. I think one of the things that they're really going to focus on as a priority is going to come down to labeling. Right now, you can look at homeopathic products on the shelves, and it might say, natural, safe, and effective remedy for headache, when frankly many of those things haven't been proven. In fact, the label will also say in teeny tiny itty bitty print at the bottom, these statements have not been evaluated by the Food and Drug Administration, and on and on. I think they might want to crack down on the labeling and the claims that these manufacturers can make.
Another new study examines the brain networks that may be responsible for tinnitus. John, tell us about the research.
So tinnitus is an abnormal buzzing or a hissing or a ringing, a high-pitched sound on and off that affects up to 50 million Americans. It's a big deal, and there's no really good treatment. There's certainly no cure for it. So this is a study out of the University of Iowa in conjunction with people from London. They had the very unusual opportunity to have a man come in who was having his brain mapped for electrical activity because he was having seizures. And the idea was to figure out exactly where the electrical activity was that was abnormal with the eye towards cutting it out with brain surgery. Yeah. So it's very invasive, putting electrodes actually in his brain. Well, it turns out he also had tinnitus. So this gave them an opportunity to study the brain activity in somebody who had tinnitus. Really an unusual opportunity. And what they found was that you would have expected that maybe just the auditory center, sort of like right around here, would have been involved, but it turned out that many, many areas of the brain were involved in abnormal activity, areas involved with memory and attention, with emotion.
I just think tinnitus is such a difficult thing to treat, and it affects so many people, right? About 1 in 5 people will experience it in their lifetimes. I know in practice it's been frustrating. Some of the oral medications don't work in certain people. I often have patients I'll work alongside ear, nose, and throat doctors, and we end up having sort of limited results. I think having a better understanding of exactly what's causing tinnitus, knowing that it involves these large areas of the brain, maybe treatment can focus on interrupting some of those circuits that are actually causing tinnitus, either using electromagnetic brain stimulation or neurofeedback, things that aren't necessarily oral medications, so people can get relief.
Yeah, we hope so. Fascinating. All right. Finally, who needs a teddy bear when you can have a tablet? A new study finds more than 1/3 of babies tap smartphones and other mobile devices before they learn to walk or talk. Researchers also found 1 in 7 toddlers uses devices for at least an hour a day by his or her first birthday. That's kind of scary.
Both of my daughters knew how to toggle on a phone. They could work an iPad probably before they could walk. But it is, again, I didn't leave them on it for an hour a day, and it's just sort of, I think it's a part of our culture now. Yeah. They see me on it, they see their dad
I feel like it was easier when they were 1 and under. Now that they're getting older, I mean, now you have a conversation and a fight.
Well, that's the thing. I mean, the American Academy of Pediatrics discourages any screen use under the age of 2. That's really tough to do in real life. Yeah. And as they get older and older and they have more and more use of these, an average 8 to 10-year-old spends about 8 hours a day in front of screens. And I remember my mother used to call television the thief of time. I think the same thing is happening with all these other screens.
And look what happened. Dr. John LaPook, Dr. Holly Phillips, thanks very much.